In this video, I'll perform muscular treatment of the TMJ. First off, I'll have the patient clench for me so I can locate his temporalis muscles. He'll relax. And then what I'll do is I'm going to actually apply a downward force about 5 times as he opens and closes his jaw. And then I'll apply an upward force. He'll go ahead and open and close for me at about this pace. And I'm using about a medium pressure here. Of course, ask the patient to let you know if the pressure is too much for them. And just rolling my thumb downwards bilaterally along the bellies of the muscles. We got one more here. He'll keep going for another 5 rounds, and now I'm going to go upwards with my pressure along the temporalis. And you can use about maybe 2 to 3 fingers here for this. Again, I'm using a mild to moderate pressure, more on the moderate side. Good. Now for the masseters, it will be the same amount of pressure, and he'll go ahead and open and close his jaw again 5 times as well, and I'll apply a pressure downwards, S to I, upwards, I to S, and then actually also laterally to account for the angle of the jaw. And I'm kind of going at a diagonal fashion to match the angle of the jaw. I'm using my thumbs bilaterally for the downward pressure here. And then he'll go 5 more times as I'm going I to S, or inferior to superior. And then I'm going to go medial to lateral on the last 5 here. We got 3 more here. Got 2. And we got 1. Good. Lastly, we'll go ahead and work on the pterygoid muscles, which are very, very, very small, so be careful because these can be quite sensitive for a lot of patients. I'll have them open the jaw for me, but actually keep it open. I'm going to go in with my index finger here. I'm going to wrap around, be careful of the gag reflex, so don't go all the way too far back. I'm going to go on the side here, and once I find that kind of cross between the 2 bridges of the teeth, he'll open up a little more for me. I'm just going to apply this kind of circular pressure with my index finger using the soft pad for a few seconds here. This can be very intense, so be careful. And have the patient let you know if the pressure is too much for them. Just a few more. And then I'll also do a nice little sweep along the buccal tissue as well while I'm at it, while I'm here. Good. He'll again open up his mouth for me and leave it open. I'll work on the right side of the pterygoid muscles. Again, they're very, very small. I'll open up just a little bit more for me. And I'm just going to apply that circular movement along the tissue using the broad aspect of my index finger. Being very careful because this can be quite sensitive for patients. And then I'll go along the side of the buccal tissue as well, give that a nice sweep while I'm already there.